Hey folks, thanks for joining us. We'll just wait one more minute while we let people in from the waiting room. Welcome everyone. I'll get started in 1 minute. Oh, so great to have so many people joining us. Okay, well, I'm going to get started. Hi, my name is Remy Shergill. I am the Campaigns and Communications Manager here at the Climate and Health Alliance. I'm just getting a little bit of feedback from someone's mic, so if you could please mute yourself. If you're not talking, I'm just sort of scrolling through muting people. Great, please keep yourself on mute unless you've got a question later in the session. Yes, so I'm Remy. I am CAHA's Campaigns and Comms Manager, and I'd like to acknowledge that I am calling in from Wurundjeri land today. The Wurundjeri land found in the Kulin Nation here in Naarm, or so-called Melbourne. I'd like to acknowledge that this land has never been ceded. I'd like to pay my respects to their elders, past, present, and emerging, and I extend that respect to any First Nations people in the room with us today. This always was and always will be Aboriginal land. At the Climate and Health Alliance, we recognise Aboriginal and Torres Strait Islander peoples as the traditional custodians of the land in which we live and work, and acknowledge that sovereignty of the land we call Australia has never been ceded, and we commit to listening to and learning from Aboriginal and Torres Strait Islander people about how we can better reflect Indigenous ways of being and knowing in our work. Thank you for being here. I'll just start with a really quick bit of housekeeping. Please keep yourself on mute. It would be great if you could update your Zoom name to have your name and the land you're calling in from and your pronouns if you're comfortable. And also feel free to introduce yourself in the chat, who you are, where you work, and why you're here today, why this topic interests you. You can use the chat box to engage with us, to ask questions. Throughout the session, we will have a Q&A section at the end, and engage with other attendees. So yeah, chuck your intros in there, that would be great. So this is our first ever session of our new webinar series called Healthy Conversation. It aims to be a space where we can bring health professionals and the community together once a month to talk about all different things related to climate and health. We want to have this be a place to exchange ideas, to learn, and to discuss the issues on our minds. And so each month will be a different topic. And so today we're starting with how to talk about climate change at work. The reason we're doing this is we have run a whole bunch of different climate communication trainings and sessions before. But the questions we get over and over again are, how do I literally bring this up at work? How do I make my managers take notice? How, like, what action can I actually achieve by talking about this? And there are people who are doing that work, and we want to make sure that their case studies get out there and they provide you some insight as to how you can also do this work. So we'll go through a quick bit of theory, really quick with me. We'll talk to our 3 outstanding climate health champions we've got with us, and then we'll have some time for questions. It will be a snappy session, so I hope you find it engaging and enjoyable. So anyone who's been to one of my sessions before might recognize this slide, because I usually start here because it is very true. Every major public health victory of the last century has had effective communication at its heart. And we don't have to look further than the pandemic, than the health crisis that we found ourselves in for the last few years. We've seen how effective communication has reduced rates of transmission and saved lives. And we've seen, on the other hand, the result of bad communication and spreading misinformation, disinformation, malinformation throughout populations, and where that has unfortunately led to bad outcomes and deaths of people. So it's the same when it comes to climate change. Effective communication is one of public health's best tools. And climate change is a public health crisis. That's not just coming from us at the Climate and Health Alliance, that's coming from the World Health Organization over a decade ago. That's coming from the Lancet the Lancet Journal, and it's come from the Medical Journal of Australia more recently. It's unequivocal that climate change is a public health crisis. And so let's use our public health tools, including effective communication. So usually who we do hear talking about climate change, though, is not people who are public health professionals. It's usually politicians, famously among Australia's least trusted professions. It might be business owners or activists. That's who we tend to see talking about climate in our nightly news, for example. But health professionals have a big role here. It's a public health crisis, and we are amongst the most trusted professions in society. And when I'm talking about health professionals, I'm of course talking about doctors and nurses, but I'm also talking about physios, I'm also talking about allied health, I'm also talking about health administrators, I'm talking about researchers, I'm talking about the people who make these health clinics work. People do trust us for our expertise in health, whatever area of health that might be. And that's only become even more prominent since COVID-19, where we saw health voices on our TV and we heard them on our radio every day. Health is a really persuasive way to talk about climate change because it relates directly to people's lives and it appeals to people across the political spectrum. People don't see it as a sort of a left-right issue. It's a universal value to take care of our health and the health of our family and our community. So we should be talking about this. Who could we be talking about it to? Here's a long list. I won't go through it all, but today we will be focusing on those last three: our colleagues, our managers, and our patients and or clients. And we've got other outlets through which we can talk about these other conversations with journalists and MPs and friends and family, and we'll talk about that a little bit later in the session. So we want to do this work. So the Climate and Health Alliance in 2020 ran a survey of, I think it was 785 health professionals about how they feel about climate change, how they're seeing it affect their work, and what they're doing about it, including, are they talking about it? So 30% of health professionals that we looked at said they already talked to their patients or clients about the health impacts of climate change. So that means there's 70% of us who aren't. And the people who are most concerned about climate change, so half of people who consider themselves alarmed about climate change were doing this work, and unsurprisingly, people who were more uncertain or even dismissive of climate change weren't doing the work. So we can't necessarily convince people who are dismissive of this work, of climate change, that this is important to do, but they are in the vast minority. There's only 6% of them. And so we can make a real difference without having to worry too much about those people who may not believe in the science. We found that the main barrier for people doing this work was that they didn't feel well enough informed, but also a substantial number of people felt that their organisation wouldn't support them to do this. So that is some of what we're going to dive into today. So without further ado, I will stop sharing my slides. So we have an excellent lineup of panelists today who are doing some of this work, talking to their patients, talking to their colleagues, talking to their managers, and can give good tips on how they're doing it. So excuse me while I look away and look at the very impressive bio of Dr. Kate Wylie. So welcome, Dr. Kate Wylie. Kate is a GP from Adelaide who is passionate about climate action to improve health. She chairs the RACGP's Climate and Environmental Special Interest Group, is a board member of Doctors for the Environment Australia, and founded Climate Medicine, which is an advocacy project whereby she presents to community groups on the health effects of climate change. In all her work, Kate applies a medical model to the climate crisis and as such offers a treatment plan for climate change. Welcome, Kate.
Thank you, Remy. Thanks for having me.
Awesome. Kate, you talk to your patients about how climate change is impacting their health. So how do you bring it up in the consulting room? And can you give us a recent example maybe?
Yeah, sure. First I'll just acknowledge that I'm calling in today from Ghana land, and hello in Ghana is Namani. So Namani everyone, and really lovely to see so many people here. So yeah, I do talk about climate change a lot at work, and I talk about it opportunistically, and sometimes I talk about it directly. Obviously in general practice land, you know, every day is different in GP land, and you never kind of know who's going to walk through your door and what you're going to talk about. So sometimes I kind of weave it into the conversation. So the ways I do that, like a really obvious example for me is when I'm talking to someone about asthma, and I might talk about what are the risk factors for asthma, and I'll say things like colds, cold air, exercise, smoke, dust, all those sorts of things. I'll talk about gas stoves as being a risk factor for asthma, and then I'll sort of end up and say, also, you know, we know that asthma is worse because of climate change. And I just say it because it is a risk factor for asthma and just put it in there, you know. So I do that quite a lot. If I find an opportunity to kind of weave it into the conversation, I just weave it in and put it out there. That sort of happens with hay fever as well. It certainly happens on very hot days. Certainly happens if there's a fire, smoke inhalation. I also do approach it quite directly, and the times I approach it most directly is when I'm doing mental health consults. So in GP land, you know, we do a whole heap of mental health. You know, that's pretty much, you know, a big chunk of my work. And when I'm assessing people for their mental health concerns, one of the things I ask about is, are you worried about your planet? You know, are you concerned about the climate? Is this something that worries you? And so often it comes up, you know, it doesn't come up for everybody, but, you know, so often it's there. So often it's something that people are really, really worried about, and having me kind of ask that question, I think, is a really important part of making the assessment. You know, eco-anxiety, climate grief's really big out there, and us as doctors, we're not really assessing that problem if we're not asking about that question. Yeah.
Thanks, Kate. That's awesome. Well, not awesome that that's coming up again, but it is enlightening just how you bring it up, because that is a question we get over and over again. How subtle do you have to be, or can you just come out and say it?
Yeah.
We'll come back to Kate, but now I'd like to introduce our next panelist, Carol Ride. Carol is a psychologist, and she's also the founder and executive director of Psychology for a Safe Climate. She worked as a couples therapist for many years before taking on this work 10 years ago. Psychology for a Safe Climate.
Excuse me, Remy.
Yes.
You're dropping out quite a bit. Can't hear you sometimes, yeah.
Okay, sorry, my bad. Once Carol starts talking, I'll go and just get my headphones. I might just throw to you then, Carol. Can you tell us about how the idea to create Psychology for a Safe Climate developed out of conversations with your colleagues?
Yeah, thanks very much, Remy. Thanks everyone for being here today. Look, we began our group by really calling a meeting of people who were interested as psychologists and psychotherapists in climate change, and quite a number of people turned up, which was really quite gratifying. And out of that group emerged the development of our group, and we started thinking about how do we understand denial and the other form of denial, which is disavowal, where you know and don't know at the same time around climate change. So we started in really 2010 and started thinking about how do we help understand the psychological factors behind the difficulty of accepting the reality of climate change. And we did this through actually unpacking our own processes of coming to terms with the reality and how we denied it and how we compartmentalised our knowledge of climate change and our denial of climate change. So we really did the work initially through exploring our own knowledge of our own processes, as well as looking up, of course, the literature, which wasn't really around climate change denial very much at that stage, but just about generally why we deny things, why we are frightened of reality, and how we break things into knowing and not knowing. So we know bits of information and we say, oh yes, climate change is happening, but we say, yeah, but we'll solve it. It's, mankind's amazing. Or we know about climate change, which is happening all the time, and then we still say, but we need to burn gas and coal. So it's we did that work really at the beginning of our work, and we wrote a booklet called Let's Speak About Climate Change, as a way of helping people understand all the psychological factors that were behind the difficulty of engagement. So this was really a psychological analysis as well as based on the science at the time. And we wrote that in 2013 and updated it in 2015. But really our work developed out of listening to the climate movement about what people needed. And we started running workshops based on our experience of being invited as a guest to a camp in the west of New South Wales, where climate activists have been opposing a coal mine, and where they were experiencing burnout and experiencing grief. And we went up there to meet the people in this camp and devise a series of workshops to support the people. And it was really through listening to those people that we actually developed what's become really quite the hallmark of our work, which is focusing on helping people express their emotions about climate change, especially through a facilitator workshop using creative materials and so on, and inviting people to discuss through that workshop process, discuss their feelings with each other and to gain support from being with each other, and understand that they're not alone and they're not isolated. So building connections between people in an organisation or a group. But it's really developed from that, from listening really to what people need. And that's what we're still doing, listening to what the climate movement needs, because that's the reason that we exist, is to try and support those who are working on climate change, to help them build resilience to sustain their ability to keep working. Thanks.
Thanks, Carol. Thank you to whoever yelled out about my sound. I have moved and I'm now operating on one screen, so forgive me if I'm jumping around a bit. We did get a comment in the chat that Carol's workshops are excellent. I've heard that feedback about Psychology for a Safe Climate over and over again. So yeah, a great thing to get along to. I'd like to introduce our final panelist, Ben. So Dr. Ben Dunne is a thoracic surgeon at the Royal Melbourne Hospital. He's the Victorian Deputy Chair for Doctors for the Environment Australia and a member of the Royal Australasian College of Surgeons Environmental Sustainability in Surgical Practice Working Party. Sorry, a bit of a mouthful. Ben is passionate about reducing environmental impact of healthcare delivery, and he's been working towards removing fossil fuels from the energy supply for hospitals, reducing the impact of surgical care on our environment, and exploring the role clinicians can take in advocating for climate change mitigation. Welcome, Ben.
Hi, everyone. Thanks very much for having me along.
Awesome. Can you tell us a little bit about what you did and how you talked to senior staff and management when you were advocating for an all-electric Royal Melbourne and Women's Hospital?
Yeah, so I think there's two very distinct groups, and sort of took two quite separate approaches to it. And really, for the other senior staff in the hospital, I think it's still a surprise to people how much the healthcare system contributes to the carbon footprint of Australia or internationally, and how much the public hospital sector contributes to that overall healthcare footprint. Although, I mean, the electricity and sort of building energy supply is not the biggest portion of our emissions when you include scope 1, 2, and 3. It's a significant chunk, And it's something that people at least are, if you're not used to talking about all the different things that play into your emissions, the energy supply is something that most people are at least pretty familiar with and can understand that, this is obviously something that is contributing enormously to our footprint if we're running off coal-fired electricity plants, or we're running our own gas-fired cogeneration plant in the hospital. So I think really phrasing it in terms of the extent of our healthcare contribution, how much of that comes down to the public hospital, and then, people need concrete, achievable actions. For a long time, I think healthcare professionals, doctors, and just people in general have felt that this is too big for them to take on individually, and have felt that our individual actions maybe don't achieve a whole lot. But providing people with concrete things that they could do, and that's different for different individuals. I mean, this one specific example for trying to get the plans for the new Royal Melbourne Hospital, which hasn't been funded yet, to be an all-electric thing, had a very specific ask from people in terms of signing a petition and supporting our kind of advocacy efforts. And that appeals to one group of people. However, I've found more broader appeal with my senior colleagues when you talk to them about things that they feel has a more day-to-day impact in terms of small changes they can make to their individual practice, be it, being a little bit more conscious about what things you use for operations that you do, or how you give your anesthetic, or what tests you order, and being a little bit more conscious around that. And then even leaning into areas that they're familiar and comfortable with, if people are researchers, kind of starting to indicate to them pathways that they could use some of their existing research skills to do some research in this area. If they're committed educators, showing them how they can start to integrate education on the health impacts of climate change into the educational curricula. So there's so many things where you can make concrete actions that people are relatively comfortable with, and they start to get involved. On the other side, there's like the hospital management group. That's a little bit different, like it or not, the two drivers for anybody tasked with, what is a very, very difficult job is running a hospital. The two things that they're thinking about the whole time is cost and patient safety. So if you can frame these sort of things in a financial or patient safety way, that's the language that they speak. Those are the things that are their bottom lines. And it's really been very helpful for us to be able to demonstrate that environmentally sustainable care is financially sustainable care. If you're, it feeds very much into that choosing wisely idea, that if you're not doing unnecessary testing, you're not spending the money on that, you're not generating the carbon footprint associated with those tests. If you're not doing procedures that have maybe, borderline evidence for them, and you find simpler ways to approach a problem, again, the costs aren't there, the complications aren't there, the carbon footprint isn't there. So trying to really link together that environmental sustainable thought process, along with the things that they're quite used to thinking about, the financial side of things and the patient safety side of things. And then finally, it's a little bit about the reputational risk to the hospital or the institution. We can see that there really is a shift happening across the country now, and people are accepting that we all need to start moving forward on this front. So being seen as a climate laggard is, increasingly damaging to an organization, particularly that's positioning itself as a healthcare organization. And then finally showing them that this is what their staff want, and bringing that in the forms of petitions or people advocating more directly, grassroots actions and working groups and work being done, starts to demonstrate that there's a huge level of commitment from the people that they depend on to get the business done from day to day, to the issue of climate change and become a more sustainable healthcare provider.
That's
I ran on there quite a bit there, sorry.
Yeah, no, that was fantastic. You sort of did touch on it, particularly when talking about framing some of this progress as financially sustainable as well, because we do hear from a lot of people that they're worried about bringing up climate or sustainability with their managers because they think that the bottom line is everything. So that is a barrier that you've sort of touched on, and you appear to have overcome. Were there any other barriers you faced when bringing up say, the all-electric hospital for the first time, and how would you recommend overcoming them?
I think the all-electric hospital thing was a little bit confronting, just because there's a few in the pipeline in Australia already, but there were none in existence here in Australia, certainly none in Victoria. They've just announced that the new Melton Hospital will be all-electric, which is great. But I think our executive team were a little bit afraid that, look, if we make this something that we go and we say, like, it's a do or die, this has to be an all-electric hospital or nothing, then the state will just say, well, then we're just not going to, that's too hard, we're just going to go and build a different hospital. So there's a bit of concern about that, but actually the Department of Health were relatively open to that idea and considering that approach, which they've demonstrated with their, when they funded the new Melton Hospital. And we're optimistic that when our plans get funded, it'll be all electric. That's sort of been built into the master plan now for the place. We're just waiting for Treasury to fund it. But I think that was the biggest barrier, the fear that they would just say, oh no, this is just too difficult, and walk away.
Yeah, we definitely hear that feedback. And on the topic of, I guess, the fear about how people might react to hearing about climate change in, say, a clinical setting, I'm going to pass to Kate. Kate, we ran a survey in 2020 which showed that some health professionals believe that climate change is a high-risk subject to discuss with their patients, and that they're concerned about the negative reaction they might get. I'd really be keen to hear about your experience and what you'd say to anyone here who might be concerned about this having a negative reaction in their workplace.
Yeah, sure, Remy. I don't get, it's very rare for me to get a negative reaction. My real answer to that is I wouldn't worry about it at all. I very occasionally might get some grumpy person say, oh, climate's, not a man-made problem or whatever. And they will be saying that in reaction to one of the many posters that I have in my room that talk about climate. And you might be able to see Climate Change Makes Me Sick behind me, which is a CAHA poster that I've had up there for ages. No, I don't get negative reactions. And I think, over time, I'm less and less worried about going there and talking it up. I think, we're in a world where the impacts of climate are becoming increasingly obvious. We had the massive fires 2 years ago. We've had all those floods this year. And so, it's there. Everybody knows about it. Climate change is so often the elephant in the room. No one's talking about it, but we all know it's there. And so one of the most common reaction that I get, especially in the mental health consults, when we start talking about climate, the first reaction I get is relief. The people are relieved that I'm bringing it up, that I'm addressing something that they're scared about, and I should, if I'm a doctor doing my job properly, I have a duty of care to talk about the most important health problem of our time. What am I doing if I'm not talking about climate? And I also think, as doctors, we talk about all sorts of extremely personal things all the time. We talk about bowel habits, we talk about sexual health, sexual orientation, we talk about drug use, we go there, we talk about all this stuff. So why don't we go there when it comes to climate? And the more you do it, the easier it gets. The first few times I started talking about climate, I was a bit scared, but I thought, okay, be brave, Kate, you can do it, have a go. And the more I do it, the less scary it is. I mean, it does help that I do have a lot of cues in my room. So, I'm wearing a badge right now that says Doctor Concerned About Climate Emergency, and I wear that to work all the time. I've got the poster there. I'm just going to move my thing. I've got a whole, shelf of posters as well that are all about climate care is healthcare. And, so all my patients know that I care about this, and, it hasn't stopped me having work. I've got a 3-week waiting list to get in to see me. So, my basic take home is it's not negative. We don't have to be scared about talking about it. And in fact, it's our job to do so. Yeah.
What a great line, Kate. I'm going to steal that. We don't have to be scared about talking about it. And in fact, it's our job to do so. I think really sums it up, because it is a legitimate health problem. And it's been so politicized that we feel a bit scared of it, but part of our job is to actually remove well, it's not our job to remove the politicization, but by us talking about it, it can depoliticize what has been a very complex.
And can I just add on that then, like if we frame climate change as a health issue, which is fundamentally what it is, we take it out of the hands of the politicians. It doesn't become a left versus right debate. It becomes a health problem, and then what do we say if it's a health problem? Then we need to treat it. So the second half of the sentence kind of invites action on climate change, which is, what we have to do, right? That's the fundamental. Yeah.
Thanks, Kate.
No worries.
Carol, I'm going to come back to you. You've said to us that you believe that for people to have a meaningful conversation about climate change with their colleagues, one must first be in touch with their own climate emotions. So that's been said in conversations with CAHA staff before. Could you maybe expand on this a bit and tell us more about the thinking behind this?
Thanks, Remy. Well, Kate actually is a very good illustrator of the case. I think that she obviously has really deeply connected herself, and so she's able to respond to people. Unfortunately, we've had some experience and feedback that some mental health professionals are not in touch with their own knowledge or emotional connection with climate change, and so they do not respond necessarily appropriately with people who go to them for mental health support. And if they raise climate change, they don't get a response that actually is appropriate. So one of the areas that we've moved into is helping those who are working as mental health professionals to actually deepen their knowledge of climate change and know their own emotional response to climate change, and have realised that that's a process that they need to go through to come to terms with the reality, and that only if they've done that are they going to be able to hear what those who come to them actually are concerned about, and respond to them with empathy and appropriateness. So, and it's really, I guess this applies also to parents and their children, that if parents haven't understood climate change and also worked out what they feel about it, they're not going to be able to respond appropriately to their children when they bring the issue up. And this is so, it's all sorts of relationships. If we're going to have good conversations about climate change, we really believe it's not just a knowledge issue, but it's actually an emotional issue to actually know what it is that you are feeling about the issue, so that you can actually hear what somebody else is saying and really respond with empathy and appropriateness. So this is why we've started a Climate Aware Practitioners Network, where we're actually running professional development for those who are working as counsellors and psychotherapists and psychologists, to help them have the experience of discussing their emotions in a group with other colleagues, to understand the ways in which they protect themselves from knowing the reality, and so they can understand how other people protect themselves from knowing the reality. And also then they can deepen their knowledge and deepen their capacity to respond in an empathic way. And of course, that's the most helpful thing to those that come to them for support, because it helps people, of course, to know that those who they're going to actually get it, and they're able to then feel their feelings are legitimised. And that's a great step in the right direction. That I could go on, but I'll stop there.
No, that's fine. I was trying to find my unmute button. That's really helpful, and I know.
Okay.
I know. I deeply relate to that. The process of understanding your emotions about climate change can be, very intense, but it definitely helps you on the other side. Carol, I'll ask you the final question that I have for you, and then each of the panelists, and then we'll open for a Q&A. So just thanks for everyone who's been putting questions in the chat. Millie is tracking them closely, so do feel free to pop them in there. So Carol, what advice can you give to people who are here today who want to talk to their colleagues about climate change at work?
Well, I guess it's sort of understanding human nature, that we actually many of us don't like to hear somebody's sadness, hear somebody's grief, hear their distress. So that it means that when somebody might tell us what they feel, we actually might block them by not really allowing the space for them to talk about what they really feel. So I guess I'd say one of the tips is to actually not only know your own feelings, but also know that and have the capacity to let somebody be distressed or be sad or be upset. And if you give people that permission, you're going to hear more from them rather than block them. So I think we all need to know how we block people. In our society, we just don't like grief. We don't like sadness. We try and make things better quickly instead of letting people talk more deeply about what they really feel. So I guess I'd say one of the things is about actually being able to really listen deeply and give people space and not step in and try and make things better immediately. Climate change does arouse feelings of grief. Really, grief has got lots of faces, but it's sadness about the reality. It's about fear about the future. It's pain, it's anger, it's despair that are all packaged into grief. And we really need to be able to know the whole range of things so we can actually hear what people are saying and respond with empathy and legitimize their feelings. So that's one of the most important things. But I guess the other thing is to know that sometimes it's actually hard to have a deep conversation with people who are colleagues. And this is what we've discovered when we run workshops for groups of climate activists or people who are working in the climate space as researchers or policymakers, that actually if we create a setting where we give people a chance to talk about what they feel, we often do that with using creative materials to sort of prompt them, and working in small groups, we often find that people feel so much relief at actually having permission to talk about what they feel with their colleagues, and that they really needed that sort of structure to begin the process. But when they've started that, they feel the relief, but they also feel a much deeper bond with the colleagues because they discover someone they've been working for 8 years. They've never talked about how they feel about climate change, even though they might be working on solutions. And so it actually builds much better connections, and it also helps prevent people ignoring someone who's in difficulty. Like we know that burnout in those working on climate change is rampant. And so we need to be on the lookout for each other. So sometimes people just need some help to begin that process in an organisation so that they can actually talk more freely, and they can also offer support and be on the lookout. And so someone can come to a college and say, I'm not coping, you know, and I need some time off, and it can be understood. They don't hide it or just be away or be absent or just bury themselves in work, which is one of the other things that we see happening, that people are so worried they're actually working just unreasonably hard. So I guess that's the nuts and bolts of it.
That's great. Thanks, Carol. That was very enlightening. Ben, similar question for people who are here who want to talk to their managers or senior staff about sustainability and climate change at work, what would your tips be?
I think a lot of it comes back to the two things that I sort of highlighted as like the drivers for the people who are trying to run the place, you know, it being cost and patient safety. But realistically, I think starting with something small, starting with something easy, starting with something that's going to save a bit of money, and really, even though you might want to take on the big things and make huge change straight away, don't underestimate the power of even small wins to generate some hope, generate some momentum, you know, bring some attention to you that will bring others to you who also want to make these changes. And that's where you can build the momentum to take on the thornier issues. So starting small, starting with stuff that you can win with, and trying to pick ones that will save some money, make things better for your patients. It's hard to argue, it's hard for them to put up barriers against that. And then those sort of successes, you know, the momentum is very powerful.
Thanks, Ben. And Kate, last but not least, for other health professionals here today who might want to talk to their patients or their clients about climate change, what would your tips be?
The first one would be just to give yourself permission, that you're allowed to talk about it. As you said right at the beginning, Remy, we're trusted messengers. And so we can use that voice to, talk about climate, to address that elephant in the room. So yeah, first give yourself permission. Second one is recognize that you don't have to be a, super expert on it. There's this whole thing of, well, what if I, don't know 100% about, I don't know, carbon reduction schemes, or I don't understand the difference between green and blue hydrogen, or whatever it might be. You don't have to. We're not super experts on all the very rare diseases. How much do I really know about Ehlers-Danlos syndrome? Do you know what I mean? But so you don't have to be an absolute expert. Personally, I find the cues extremely helpful because it means that people already know that I care about it. So I can say, like when I weave it in, I'll just say, because it's pretty obvious that I care, right? So that they've already got that cue there. And yeah, basically like weave it in. Just find a way to say a half a sentence about something. You don't have to then go, climate change is caused by the combustion of greenhouse gases. And, by the way, there's this other problem about biodiversity and methane. You don't have to give them every answer. You can just give them a bit, because, what I really think is, very interesting, all the stuff that Carol's been saying about the psychological stuff. We have this massive denial problem, and what we need to do is shift the narrative to normalize talking about it. So, if I as a GP, have a half a sentence about climate to somebody, then I've just normalized this as a conversational topic. This is just something that is there rather than kind of pretending. And yeah, so weave it in. But I also do think that we as doctors, especially in mental health consultations, we should ask about it, because, those people out there all of us whose eyes are opened, we are alarmed. We do all, I'm sure everybody on this call has climate anxiety. We all have the grief, and so we need to acknowledge it with each other. And so, yeah, absolutely acknowledge it with our patients. And yeah, but really have a go.
Thanks, Kate.
If you try, what's that thing? If you don't try, you fail anyway. So have a go.
That's awesome. Thank you. I'm going to just super quickly add, because I really liked what you were saying about health professionals don't need to be climate experts. Health professionals are trusted because they are experts in health. So if you bring up climate change, you don't have to explain what climate change is. You don't have to explain how it's caused. You don't have to explain the impacts. You just need to talk about, and not Kate, you, like universal you, you just need to feel confident in the fact that you're already an expert in your field and that you have legitimacy talking about it, because we do see that as a barrier. People say they don't feel well enough informed, but actually when you talk to them, they are very well informed about how heat or fire or mental health or spreading disease might affect their patients. They just maybe don't feel like they know the science of it enough, and you don't need to know that to have these conversations.
No, not at all. Yeah. And people, I've never had anyone ask me to explain global warming in that way. Like no one's ever said, well, what happens when I turn my gas on, and, like it's never come up. Yeah. People are more interested most people are self-interested, really. They're interested in themselves and their family. And so it's more about addressing those things.
Awesome. Well, thanks, Kate. And we're going to move on to the Q&A. Thanks, everyone, for your comments in the chat. I'm just going to throw some questions out there with who I think it might go to, but an opportunity for you all to just jump in if you've got something additional to add. I think I will throw the first one to Kate. So Marion asked you, you can bring up climate change and then the next step is to treat it. What sort of actions do you talk to your patients about to treat climate change?
Yeah, sure. So there's two arms of that. One is like treating whatever the health problem that they have is. So like if it's talking about asthma, it's the need for having your asthma well controlled and taking preventers and reducing risk factors. But I also have like a list of 10 things that every individual can do to address climate. And I've got a website on which I wrote called Climate Medicine. And on that website, I list those 10 things. And, like the first one is to learn about it, is just, like to be informed. The second one is to talk about it and, address the elephant in the room. But I also talk about things like switching your bill to a renewable energy provider, which is like simple and takes about 3 minutes, like a small individual action. I talk about divesting, taking your money out of banks and financial institutions that support fossil fuels and putting it in ones that don't, don't give the bastards your money, basically. I talk about diet. I talk about transport. There's 10. I'll talk about gardening and planting and, having trees, voting for your climate. And I also talk about individual actions, so acting for your climate. And it's quite interesting today, both Ben and Carol have found the thing that they can do for their climate. And it's that sense of thinking, well, what can I do? What's my particular area? What's my skill that I can bring to the table? Because obviously it is an overwhelming problem and none of us can solve it individually. It requires collective action. So it's like, so like for me, what I can do is what I'm doing, which is doing these sorts of things and talking to my patients. Whereas if I was a gardener, the thing that I could do, well, what my partner can do is grow a whole heap of fruit trees around my house and, get some carbon into the soil and help us provide our food and have less, become more self-sufficient. So it's this sort of thing, well, what's your thing? So I try and explore that with people and help them kind of find something. And also that they don't have to do 50,000 things, like start with one thing, like look at the list and do one. You don't have to do all of them straight away. It's too hard. No one can do that. So just start with one, acknowledge that you've done that, and then go on to the next thing.
Yeah, awesome.
Yeah.
I'm going to just move on to the next one. And whoever wants to join can jump in. Had a comment from Sahela. Do you think there's a role for patients to talk to their health professionals about climate change? I'm just thinking about the great work that Kate does, but that I've never encountered a GP or mental health professional that has brought up climate change. I might go to Carol first, just because Kate has just spoken, though I will come back to you, Kate.
You're asking me about that?
Yeah.
Oh, okay. It's interesting. I've had that issue too. Is GP not the slightest bit interested when I've said what I'm working on? So you're saying, should we continue the conversation with them to get them on board? Well, I think it probably can start for, look, I really care about this, and talk about what you care about and why you care about it. And you never know when you've dropped something into a conversation, if you've done it in a manner that's respectful to the other person, what they'll do with it later. I always think that as long as you speak in a way that it sounds like you know what you're talking about and you're doing it in a way that's respectful to the other person, that you never know what you'll do with it. And so I think it's worth raising it. I think we've all got to do our bit in that direction.
Of course. Anything to add to that, Kate or Ben?
I couldn't agree more with what Carol said. How many times have you heard something, not really knowing what to do with that information, gone home, pondered it, it sort of sat around in your head for a day or so, and then you think, oh, that actually makes a bit of sense. I might kind of look into that a little bit further. I think starting conversations and planting some seeds with people, and then it's up to them where it'll go. You're not going to win everybody over. You might win a proportion of people over, but all you've done is have a 1 or 2 sentence conversation with them, and it might have a significant impression on them.
And isn't that something that we all reflect on personally, like the thing that got me involved, so to speak? Like when I look back and think, why did I start caring about, like, join Doctors for the Environment or start thinking as a health professional that I could act on climate, was because that others had done it before me. And I was like, oh yeah, they can do it, I can do it too. you know, we just, yeah, as you say, plant the seeds, and then slowly we're shifting Overton's window. We're shifting what is the normal thing to talk about to get it to that place where it needs to be, which is, you know, 24/7 what we're thinking about.
Yeah.
Yeah.
There's a great story from Fiona in the chat, who now, when she goes to visit her GP and dentist, they feel compelled to tell Fiona what they've been doing in the space. So there you go. I'm not surprised. She is relentless. It's a very, very good story. Thanks for sharing, Fiona. I've got another question, and I'm really interested because it talks about the idea of how do we convince people who are really busy at work to add this to their big pile of things they're already doing or worried about. So the question comes from Carolyn, and Carolyn represents her college for nursing and health sciences at Flinders University in their sustainability plan. She says, in the college itself, we're not having any conversations about sustainability, especially in relation to health. With a colleague, we're about to put a call out to the college to bring a group together and come up with an action plan on what we as a college might do. My question is, has anyone done something like this, and what process you went through? What were the hooks for people to become involved in their busy work life? So it might be a little bit specific, but even general advice about how do you bring a group together and how do you make it interesting to them when they're probably already busy. I might throw to Ben because I feel like it sort of aligns with maybe some of the work you did.
Sure. I'm sure Kate could chime in and Carol as well, but their involvement with their respective colleges. I think the College of Surgeons might be a relatively good one to draw some parallels with as well. We had a small working party with the incredibly awkwardly titled name that you kind of managed to work your way through at the start there, Remy, the Environmentally Sustainable Surgical Practice Working Party. And for quite a while made very little inroads with the college in trying to get anything changed or achieved. And membership was not enormous, but it's sort of about being a bit of a, like, I think you're doing exactly the right thing and putting a call out and getting a small group of people who are passionate together. You can start to become a bit of a voice that then just sort of continues to chip away and, you know, sends emails, sends letters, makes phone calls to the people a couple of levels above you. And they just start to hear about it, and it starts to get onto their radar a little bit more. In terms of getting others on board, what we found was actually amazingly successful was we just designed a survey to send out to all of the surgeons through the college, asking their opinion on, you know, what do you want? Do you want some more information on how to make your own practice more sustainable? What do you want the college to do? What should we be doing in relation to kind of liaising and advocating with, you know, the medical device industry? And then at the end of that, it was like, well, you know, if you want more information, put your email address here. And, you know, if you would like to join our working party, put your email address here. And we've had about 300 responses and about 50 people say they want to join the group, which, you know, these things always filter down once, you know, it comes to it. But trying to engage people, asking what they want, asking their opinion on things, you know, giving them a sense that, you know, this organization that you're part of, there's a group of us here that care. We want to know what you want from us. We're going to try and make some positive change higher up the food chain than us, you know? So I think you're going about it in exactly the right way. You know, find a core group to bring it together, workshop some ideas, start to make some noise up the food chain, and then amongst your colleagues, people will come.
Yeah, survey's a great idea as well, because it, you know, then gives you some data that you can refer back to over and over again. Kate, Carol, do either of you want to jump in on that one?
Yeah, I'd have a little bit to say. Like, firstly, Carolyn, like, good on you. You know, like, what a great thing to do. And, you know, like, certainly the experience within the RACGP was that, you know, the changes that were made within the college started from college members, where, you know, a group of passionate GPs got together and formed the RACGP's Climate and Environmental Specific Interest Group. Why do these all have such hard acronyms? Maybe come up with a simple name.
Yeah, we're not very good at punchy names in the health sector, but anyway.
But what it meant was that the like-minded people had a place where we could talk and where we could work together rather than being lone wolves off all by ourselves. And so collectively much more powerful. And, you know, this group has really helped shape a lot of what the college has done. And now, you know, the RACGP has declared a climate emergency. They've got an interim emissions target of 80% by 2030. You know, like the college is doing really good things. It's got a sustainability group and all of that sort of stuff. But that started because concerned doctors put their hands up and said, we want something done on this. And so, you know, you can be really powerful. You can make a massive difference. And, you know, and the other thing is it's collegiate. You know, you get to talk to other people that care about the same thing you care about. And that helps a lot when it comes to addressing our own emotions about climate. It's good to know that other people care and see it the same way as you do. Carolyn, I'm in Adelaide as well. So, you know, like if you want to get my details off Remy, I'm more than happy to talk offline as well. That'd be awesome.
That's awesome. Thanks for that kind offer, Kate. Carol, do you want to add anything to that? You're on mute.
I'd just add that when a group gets together to do that work, I think it's always a good idea to also check in how they're going and, you know, maybe start a meeting with, you know, how are you going on this? How are you coping? Because I think when people take on an extra responsibility, it can be, they need to know that other people understand how they're tracking. So just 5 minutes or 10 minutes at the beginning of a meeting is sort of checking in, 2 words. It can be very bonding for the group, and that sort of bonding helps them sustain their ongoing work together.
Thank you, Carol. I'm so sorry, but we're almost out of time. So I know there are some questions in there which were really good that I didn't get to. I will be answering them on CAHA's social media channels, probably Twitter. So if you did have a question and you really want it answered, it will be answered over there. Alternatively, just email us back and I will make sure that you get the answer to those questions. We do actually have some really good events coming up which build on some of the things that we learnt here today. So the first one, the 14th of July, Psychology for a Safe Climate. So lovely Carol here has a session called Practicing a Deeper Conversation about the Climate Crisis with Your Colleagues. You've heard testimonials in the chat that Psychology for a Safe Climate run excellent sessions. I would highly recommend getting along to that one. We at CAHA, I'll be running a media training session for health professionals on the 21st of July. So if you want to take some of these conversations out into the broader world, we've got Media Training 101. It's for total beginners to people who maybe have had a little bit of experience, and everyone is welcome. And then on the 2nd of August, we have a workshop with climate by the Climate and Health Alliance and Climate for Change, how to have effective conversations about climate. And that's really not about conversations with your colleagues, it's about conversations with friends and family. So there will be links to all of this. We will be sending a follow-up email today. And with some of the resources that we discussed in the session. We will run our next Healthy Conversation in July, and all of you will receive an invite about what it's about and how to join. And we'd love to hear if there's anything you'd like to hear about. Feel free to send through your ideas to events@caha.org.au. And if you have enjoyed the event today and would like to support us, you can become a member or, make a donation. So there's a link to the website in the chat. But we are so grateful for everyone who has made it today. I hope you found it enlightening. And please do look out for our email, which will come sometime today. And we will be putting this session online. So thank you, everyone, for coming along.